It is the calm before the proverbial storm for Dr. Newsy. He knows the coming months here will not be this quiet.
Things are different compared to last year.
Dr. Chaloumi oversees family medicine at East Boston Neighborhood Health Center, a low-income nonprofit that is starting to work overtime to make sure the most vulnerable get their flu shot this year.
The flu actually kills people. Every year we have, mortalities from influenza. And so we don't want to lose sight of that.
One of the biggest reasons health officials are urging Americans to get their flu shot this year in particular, hospital capacity. With ICUs already at their breaking point, a surge in flu cases could be catastrophic to the healthcare system.
Healthcare workers are really tired. This has been really exhausting for people who work in healthcare during the pandemic, and it's just hard to keep going with no light at the end of the tunnel.
With flu season and a COVID surge about to collide, many Americans might feel a bit overwhelmed when it comes to vaccines. So we posed a few questions to Kristen Nichols. Be okay for me to get both vaccines on the same day?
So the CDC currently does recommend that it's appropriate to get both vaccines on the same day.
Nichols is an infectious disease pharmacist. She wants people to know that it is safe to get the flu vaccine and the COVID vaccine or booster at the same time. If you get both shots on the same arm, spread them about an inch apart. Although Kristen Nichols recommends using different arms for each shot just to reduce some soreness.
I would never pass up an opportunity to get vaccinated. So if you're going to go get vaccinated, I would go ahead and get both vaccines at the same time.
Some people, though, might want to space out their vaccines.
If I was feeling nervous about getting both and I was going to pick one, I would go with COVID first, given that the Delta variant is circulating and can be quite deadly.
What if you get sick this fall or winter? Most doctors' offices will simultaneously be testing patients for the flu and COVID to determine the right course of treatment. Either way, with so many more Americans moving around this fall, the risk of getting sick is high. So doctors want as many shots in arms as possible.
It's reasonable to be hesitant. It's reasonable to have concerns, but I would urge people to talk with a trusted healthcare provider, a physician, a pharmacist, and get some of those questions answered.
Because with so much uncertainty looming, health officials just want people to be protected. I'm Chris Conti.